Earlier this week, an FDA panel was convened in order to discuss the use of SSRIs, or selective serotonin reuptake inhibitors, in pregnancy. So, hi, I'm Dr. Christina Madison, also known as the public health pharmacist. I just wanted to come on and discuss this and why. It may seem innocuous, but really this is potentially all about denying access to life-saving medications for pregnant women. So the use of SSRIs during pregnancy and actively treating mood disorders during and before and after pregnancy has been going on forever. ACOG, which is the American College of Obstetricians and Gynecologists, came out with a statement saying that, that this committee that was convened, this panel, really was acting as if they were wanting to limit access. So the way I like to think of it was that it was a solution uh, looking for a problem, because there was already an outcome that they wanted, which was that they wanted to have more restrictions and more barriers to pregnant women receiving life-saving medication to treat their mood disorders during their pregnancy because of a perceived risk of safety or harm to the fetus. So we have lots of case reports in this arena, but one of the things that they brought up during the committee meeting was that they had not had robust randomized clinical trials with pregnant women in them, which happens all the time because there are ethical concerns about actively giving someone a medication, not knowing what the potential risk is to the baby. So what does that leave us with? Well, one of the things that I would like to say is that we want to be fact and science based. And the way that we can do that is by advocating for women to have choice. So, really, this should be between a woman and her doctor. And ultimately, we know that there is way more risk and harm to the baby if major depressive disorders are untreated during pregnancy. As somebody who experienced postpartum depression after both of her children, I would have been extremely sad if my healthcare provider had denied me access to these types of medications. So, if you guys want to know more, I will leave the link to